So photobiomodulation therapy was the project that the palliative care led by Alex did as part of the Green Team competition. Photobiomodulation treating mucositis in patients with base of tongue and tonsillar cancers. So just for a bit of background, mucositis is very common in patients following chemo and radiotherapy. There's a horrible picture there of somebody struggling with that condition. Results in patients experiencing very severe pain and complications. And they need, on many occasions, admission to hospital for pain and nutrition. Often quite complex is the management of these patients. They pose a significant risk of getting infections and sepsis. And along with these problems, they experience problems from a range of different reasons, really, from physical, psychological, and the problems have a real social impact on patients if they have nasogastric tubes, if they find it difficult to eat. So it's all kind of those, very much those things that we rely on in our social lives that is very disturbed in these patients. So the PBM, this is a picture of Alex with the machine there, and what PBM or photobiomodulation therapy does is it treats patients to prevent mucositis by applying a light source, which does three things. It increases the cell metabolism, it promotes healing, and is all about reducing inflammation. It's really, really simple to use. Once the patients have been shown how to use it, they can pretty much do it themselves, and it also has NICE approval. And this is a picture of Paul from the company Thor, who produced this machine, just demonstrating the use of it. So there's two elements to the photobiomodulation. There's like a lollipop probe that goes inside the mouth, and then there's a head on the machine that is a bit like a shower head, and it goes outside of the mouth. So it's kind of tackled from both respects, and the patients have to have a minute of therapy for each. So what Alex did in her study, she looked at 22 patients, 11 formed the control group, 12 as part of the treatment arm. With the control group, she obtained patient data retrospectively. In the treatment arm, she had patients who had 30 sessions of PBM that ran alongside their radiotherapy. So it didn't involve extra visits to the hospital, extra appointments. They had them just before going for their radiotherapy appointment. In total, a 50-minute session with PBM at very low staff input was required from a training perspective. So it's very simple to use. You just kind of put the lolly in or put the shower head on your cheek and off you go, turn the button on and off you go. So the retrospective data collection, what Alex looked at was the severity of mucositis symptoms. She looked at the frequency and length of unplanned admissions, the type and dose of medications that were required to control pain, and then what further treatment the patients then went on to require, what interventions they had. And she looked at whether or not that included nasogastric tubes or antibiotics. So while Alex was doing this, I was working on my sustainability projects, and like I say to everybody, I can't ever, now knowing what I know about the environment, remove these sustainability lenses. I see everything through this perspective, and kind of want to talk about it with managers, with colleagues, with patients, with my family, with anybody I come into contact with. I've left off politicians there, they've not kind of, they've not escaped. But as healthcare professionals, I wanted to kind of put across that we have a really strong voice with regards whatever we say, really, and therefore we should use it to kind of get across our agenda in a real clever way, in a way that we're very much trusted. You know what we say, we're very much trusted, so we can influence people. So I was doing this sustainability work, Alex was doing her project anyway, and I kind of didn't think the two were related until I heard the outcomes of this, and it made me think, well, actually this would be really good from a green perspective. So like we all kind of realise that healthcare plays a significant part in global emissions, accounting for around 4%, equivalent to all of those from Denmark, and if it were a country, it would be the 5th largest polluter. Simon Stevens has claimed that climate change poses the most profound effect human public health, and that avoidable deaths are happening. So we need to be acting now. Climate change threatens to undermine the gains we've made to public health over the last 50 years. So all of that, bearing all of that in mind, when the Green Team competition was introduced and we got the funding to introduce it into our hospital, I suggested to Alex that PBM might be a really good project to consider as part of the Green Team competition. So looking at improvements for patients with a reduction in the environmental, social and financial implications of our treatment, so that triple bottom line. And I felt the PBM really kind of stood a good chance of meeting all of these requirements and, you know, been a strong contester. So this was a picture of Paul from PBM, Thor, who, when I mentioned about the green side of his treatment, he said he'd never heard of this. Nobody had ever mentioned it. Each time he'd been out talking about the benefits of PBM, he said, nobody's ever mentioned this to me. And I was going, you're kidding, aren't you? So this is how I see everything. But this could be a real string to the bow of this treatment therapy, that it has this added green benefit to it. So what then Alex did as part of the Green Team was that she looked at the retrospective data that she'd collected, and then she added in, as part of the Green Team competition, other things that then looked at the more environmental impacts of the study. So all of the other things that she'd mentioned, severity of symptoms, hospital stays, all the medication. She also looked at when medication was commenced and what medication was in use 6 weeks post-treatment. We measured the environmental impacts of all of this as well. So the results of the 11 patients, Alex was able to demonstrate financial, social, environmental improvements. We demonstrated reduced hospital bed days by 63, with a 64% reduction in analgesic requirements, with cost savings of just these 11 patients of around £33,000. We demonstrated carbon reduction equivalent to over 2,500 kilograms of CO2 equivalent, and we could see huge benefits in the social element, so massive improvement in quality of life, physical, psychological improvements. We were able to demonstrate there was a quicker recovery, there was an ease of use in treatment, and it was non-invasive, so there was a real patient empowerment element to the treatment. I've already mentioned it had minimal staffing implications, and it was delivered alongside radiotherapy. With this, we were able to predict the benefits of this treatment over a year with all of the patients that we wanted to treat. And after the purchase of 6 of the devices, we were able to show savings of over £530,000 a year, around 43,000 kilograms of CO2, which equated to around 130,000 miles driven in an average car. And the winner of the Green Team competition at our trust was Photobiomodulation. Going forward, what we plan to do is we hope to buy 6 machines to use as part of the treatment protocols for this particular group of patients. We have a business case that we're due to have a meeting in a week or two to buy 6 devices. Sorry, that's a misspelling on there. And kind of say integrate this as part of the treatment therapies. We've been involved as well with the PBM machine in marketing this with its green credentials as well. Alex and I were at a conference only yesterday, an oncology conference, talking about the sustainability aspect of this this treatment. And we've also feel that it could be beneficial in other areas. Again, there's another typo on there that should say lymphedema. So breast cancer related to lymphedema, radiation fibrosis, and stem cell transplant in our patients. Alex and I have written about not only the Green Team competition, but about PBM particularly. So we have publications that are due out in nursing journals in the summer.